大家好，我叫 John Harry， 来自巴基斯坦的学生。我今年25岁。我2013年来中国学习。我在湖南师范大学学医，我的专业是学医。我现在在湖南省人民医院学习和实习。我获得了湖南省奖学金和湖南师范大学外国留学生奖学金。我跟外国学生上了医学课，我讲的课是自主学、生理学、病理学和生物化学。我在中国跟小孩子们讲英语课。我上英语课的学生从3岁到16岁。我在湖南省人民医院和长沙中心医院跟护士们和医生们上英语课。好，谢谢大家。
Good morning, dear viewers. I'm your host, John Harry. Dear viewers, as usual, today we also come up with a new disease. And today we're going to discuss one of the most important disease of hepatobiliary system, that is gallstone. Now, which is very, very common all around the globe. Now, the question will be arising in your mind that what is gallstone? What are the causes of the gallstone? I mean, how we develop the gallstone? What are the signs and symptoms of the gallstone? I mean, how we can know that the patient is having the gallstone, and how we can diagnose this problem, and how we can manage this problem. For to answer all these questions, today we have invited Dr. Frank in our studio. Dr. Frank is an hepatobiliary doctor, and he is working in hepatobiliary department for almost last 10 years. Good morning, sir.
Good morning, Harry.
How are you, sir?
Good, very well. How are you?
I'm good, thank you, sir. My first question is, sir, as I've already told, that what is gallstone?
Well, gallstone is very simple. Gallstone is just the stones inside the gallbladder.
Inside the gallbladder, right?
Yeah, that's right.
Okay. Now, why the patient get this gallstone? I mean, why the people suffer from this gallstone? What are the causes for this gallstone?
Well, the gallbladder, its main function is to store and release bile.
Okay.
So the stones formed when some substances inside the bile crystallized inside the gallbladder.
Oh, so when the bile crystallizes inside the gallbladder, that
right.
can lead to the gallstone formation, right?
Correct.
Okay,
yeah.
okay. Now, once the patient develops the gallstone, how the patient know, or as a doctor we know that the patient may have the gallstone? I mean, what are the signs and symptoms?
Well, in some cases, even the patient have stones inside the gallbladder, sometimes it's asymptomatic, has no symptoms.
Okay.
But in some cases, when the stones irritate the wall of the gallbladder, then it may cause problems.
Okay.
Some patients will have only one onset, and some patients have many attacks.
Okay.
So the main symptoms include a pain in the right upper quadrant.
Okay, so the pain in the right upper quadrant of the abdomen, right?
That's right.
Okay,
it may come and go, but sometimes it remains constant.
Is it very severe pain or mild pain?
Well, sometimes it can be severe. Sometimes, most of the time, it's just mild pain.
Mild pain.
Yeah.
Okay.
Also, the pain can occur in under rib or the breastbone.
Okay.
Or the pain can radiate to the back, to the right shoulder blade.
So you mean that this is radiating pain, right?
Radiating
Sometimes
pain.
does radiate on the back.
That's right.
Okay. So if it is radiating pain, now we also heard that the heart pain also radiate on the back, right?
That's right. That's correct.
So as a common person, how I would know that I am suffering from the heart disease or I'm suffering from the gallstone?
Sometimes it's really difficult to tell the two diseases.
Right.
But most of the time, when you have a heart attack, the pain will radiate to the left side.
Oh. Okay.
But for gallbladder disease, the gallstones, most of the time the pain radiates to the right shoulder area.
Okay.
Yeah, that's the main difference.
So you mean the pain is the most common symptom, right, for the gallstone?
Right. Sometimes when the stones move into the nearby ducts,
Okay.
it can cause blockage.
Okay.
So the flow of the bile will be blocked, and then like pain, infections may occur. Also, jaundice may happen.
Okay.
So the patient will have a yellowing of skin and eyes, and also
okay.
dark urine.
Oh, okay.
Yeah.
So it means that if the patient suffer from some kind of like jaundice symptoms,
Right.
then we should suspect that the patient may have the gallstone.
That's right. That's
Okay.
right. And the
Okay.
stones, most of the time, most likely the stones has already moved into the nearby ducts, like common bile ducts.
Okay. Okay. Now, once the patient suffer from the gallstone and he come to your department, let's say hepatobiliary spot department of Hunan Provincial People Hospital, how you manage such kind of patients? I mean, I know that these kind of patients must be very common in your department, right?
Very common. Yes.
Very common.
Yeah.
So how you manage such kind of patients when they come to your department?
When a patient come to our department, so first we take history. We ask the patient what his or her symptoms are, and
Okay.
also we do physical examinations. We take his or her history, and when the gallstones is suspected, so we may the patient may be scheduled for a ultrasound test.
Okay.
So ultrasonography actually is by using some kind of sound wave
Okay.
to detect the gallstones.
So like first step is to diagnose, right? First step is to diagnose, like
Right.
you do the ultrasound, then different kind of physical examination and history. With
Yeah.
these tests you do diagnose.
Yeah.
Okay.
Most of the time, ultrasound.
Ultrasound is the
Ultrasound
most
is
common.
the most common, the cheapest, and also the most sensitive test.
Okay.
Sometimes include to have a thorough examination of the gallbladder problems.
Okay.
The patient may also be given like CT scan or MRI
Okay.
test.
Okay. So these are like preserved. But first is the ultrasound, right?
That's right.
Okay. So once you diagnose that the patient, you're confirmed that the patient have the gallstone. Now what is the next step in management? I mean treatment.
Well, the best way to remove gallstones and prevent a new one from forming is by removing the whole gallbladder.
Okay.
Yeah,
So you do remove whole gallbladder.
the whole gallbladder. That's right.
Okay.
Only by doing this you can prevent new ones from
Okay.
forming. So nowadays we are doing this kind of surgery by a type of surgery called laparoscope.
Oh, so you do
It's
the
different from traditional open surgery. Like
Okay.
we only have some small cut
Okay.
in the skin, and we put a camera inside the abdomen, and then the doctors will see the pictures transferred out from the camera and operate.
Oh, so you do the laparoscopy and remove the whole gallbladder.
That's right.
Okay. So once you remove the gallbladder, can the patient recover? Can the patient stay like the normal person after you remove the gallbladder?
Yeah, no need to worry about that.
Okay.
The gallbladder, the main function of gallbladder is to store and release the biles.
Okay.
So when your gallbladder has been removed, so the liver still produce bile, can release to the duodenum and help break down fats.
Okay.
So your digestive function won't be infected that much.
Okay, that's all right. So why? I mean, why did such a huge number of patients suffer? I mean, when the patients suffer from this disease and they come to the hospital, it can cause a lot of medical cost. Right?
That's right. That's right.
It is like it can cause a lot of money, and it is not only in China, but it is all around the world. It is a very common disease. So why do you think the people are suffering from such a disaster so often?
Well, there are certain high risk factors of this disease. It's like a heavy diet,
Heavy diet.
heavy diet, too much, fat food, right?
Okay.
Also,
So it means I should not eat KFC, right?
KFC, but not eat too much.
Okay,
not eat too much. Okay. So also long-term fasting.
Okay.
For some people, who don't like to eat breakfast.
Oh.
So the biles have been stored in the gallbladder and for really long time and without reach to the duodenum to help the digestion. So the substances can crystallized.
So you mean that the breakfast is also very, very important?
Very important. And also like for some females who have multiple birth.
Multiple birth.
Right, that's right.
Okay.
And she will maybe have more chance to get this disease.
Okay. So you mean that the diet full of fat and not having the breakfast and the multiple birth, right?
Yeah.
How about the obesity?
Obesity, that's right.
Obesity.
Is also like gallstones is also like more common in obese people. That's right.
Okay.
So you have to keep fit, right? Eat a balanced meal, and also you have to keep keep your blood cholesterol level.
Blood cholesterol level should also be down, right?
That's right.
Okay. Thank you very much, Dr. Frank, for your precious time over here.
Thank you for inviting me.
Okay, thank you, sir. Dear viewers, as you have seen that Dr. Frank has explained the gallstone in a good detail. I hope you guys must have learned out of it. Now, if you have any question or suggestion, you can email us. See you next time with a new topic. Till then, take good care of yourself and your loved ones. Have a good day. Bye-bye.